looks forward to working with leaders in both parties to position America to outcompete China. I don't have any additional update, though, on other considerations. Go ahead.
Thank you, ma'am. This morning, the White House put out a statement on the anniversary of Roe v. Wade. As a candidate herself, the vice president proposed an abortion rights law akin to the Voting Rights Act. Is that something that she still supports? Is that something that the president is exploring?
I don't have any update from the vice president's policy. Obviously, her policies are the policies of the Biden-Harris administration, and the statement today speaks to those policies. Oh, we have ventured to get you a week ahead, and I promise that we will do it in the future, but we don't have any really detailed specifics to share with you at this point in time, other than the president will not be leaving the DMV, I can assure you, next week, and he will continue to sign additional executive actions and engage with members of Congress. We will have a more detailed schedule, but we're still ironing out all the specifics. Thank you, everyone. Let's do this again on Monday.
Good afternoon, everyone. We're coming on the air to bring you a briefing at the White House with Press Secretary Jennifer Psaki and President Biden's Chief Medical Advisor, Dr. Anthony Fauci. Let's join it in progress.
The state of the pandemic, the status of vaccines. He'll take some of your questions. I will play the role of the bad cop when it's time for him to go and get to the work of the American people. And then I will do a topper and I'll answer a bunch of your questions as well. So there's lots to come after this. With that, I will turn it over to Dr. Fauci.
Thank you very much, and I'm going to just spend a couple of minutes just summarizing the status of where we are, and then maybe addressing some of the things that I know are on people's minds. So, first of all, obviously, we are still in a very serious situation. I mean, to have over 400,000 deaths is something that, you know, is unfortunately historic in the very bad sense. When you look at the number of new infections that we have, it's still at a very high rate. Hospitalizations are up. There are certain areas of the country, as I think you're all familiar with, which are really stressed from the standpoint of beds, from the standpoint of the stress on the healthcare system. However, when you look more recently at the 7-day average of cases, remember we were going between 300,000 and 400,000 and 200,000 and 300,000. Right now, it looks like it might actually be plateauing in the sense of turning around. Now, there's good news in that, but you have to be careful that we may not be seeing perhaps an artifact of a slowing down following the holidays. So when we see that, we think it's real. But one of the things, and it's interesting, I'm sort of getting a deja vu standing up here because I said something like this almost a little bit less than a year ago when we were talking about the acceleration of cases in the late winter, early spring of 2020, when we were having New York City metropolitan area being the epicenter of what was going on, that there are always lags. So please be aware of that, that when you have cases and then a couple of weeks later you see it represented in hospitalizations, intensive care, and then a couple of weeks later in deaths. So you have almost a paradoxical curves where you see something plateauing and maybe coming down at the same time as hospitalizations and deaths might actually be going up. So this is something that I just put on your radar screen. It is not an unusual thing to see that sort of thing. The other point I want to make is one that you're getting asked a lot regarding questions, and that is, what is it about these mutants that you're hearing about? The mutants in the UK, which we know are in about 20 plus states, the mutants that we're seeing in South Africa and in Brazil. First of all, we need to understand that RNA viruses like coronaviruses mutate all the time. Most of the mutations don't have any physiological relevance with regard to the function of the virus itself. However, every once in a while, you get mutations, either singly or clustered in combinations, which do have an impact. So what have we learned thus far? And I want to emphasize thus far because we're paying very, very careful attention to this and we take it very seriously. At least from the experience that our colleagues in the UK have had, the one that is in the UK appears to have a greater degree of transmissibility, about twice as much as what we call the wild type original virus. The one that is in South Africa is a bit different, and I'll get to that in a second. So it does look like it increases the transmissibility. They say correctly, on a one-to-one basis, it doesn't seem to make the virus more virulent or have a greater chance of making you seriously ill or killing you. However, we shouldn't be lulled into complacency about that, because if you have a virus that is more transmissible, you're going to get more cases. When you get more cases, you're going to get more hospitalizations. And when you get more hospitalizations, you're ultimately going to get more deaths. So even though the virus on a one-to-one basis isn't more serious, the phenomenon of a more transmissible virus is something that you take seriously. The next thing is, does it change enough to interfere with the efficacy of a whole group of monoclonal antibodies that many of you are aware of? The monoclonal antibodies that are being used for treatment in some cases and prevention. Since monoclonal antibodies bind to a very specific part of the virus, when there's a mutation there, it has much greater a chance of obliterating the efficacy of a monoclonal antibody. And we're seeing in the much more concerning mutations that are in South Africa, and in some respects Brazil, which is similar to South Africa, that is having an effect on the monoclonal antibodies. The real question that people are quite clearly interested in is, what is the impact on the vaccine? And so far, literally, we have this new phenomenon that are preprint journals where people get data and they put it into a preprint server where it hasn't yet been peer reviewed. But you have to pay attention to it because it gives you good information quickly. Ultimately, it gets confirmed. And we're seeing them coming out over the last few days. And what they're saying is that what we likely will be seeing is a diminution, more South Africa than UK. UK is that a diminution in what would be the efficacy of the vaccine-induced antibodies. Now, that does not mean that the vaccines will not be effective. And let me explain why. There's a thing called a cushion effect. So if you have a vaccine like the Moderna and the Pfizer vaccine that can suppress the virus at a dilution, let's say, of 1 to 1,000, and the mutant influences it by bringing it down to maybe 1 to 800 or something like that, you're still well above the line of not being effective. So there's that cushion that even though it's diminished somewhat, it still is effective. That's what we're seeing, both certainly with the UK, which is very minimal effect. We're following very carefully the one in South Africa, which is a little bit more concerning, but nonetheless not something that we don't think that we can handle. What is the message? Because someone could say, now wait a minute, if you have the possibility that the vaccines are diminishing in their impact, why are we vaccinating people? No. It is all the more reason why we should be vaccinating as many people as you possibly can. Because as long as the virus is out there replicating, viruses don't mutate unless they replicate. And if you can suppress that by a very good vaccine campaign, then you can actually avoid this deleterious effect that you might get from the mutations. Bottom line, we're paying very close attention to it. There are alternative plans if we ever have to modify the vaccine. That is not something that is a very onerous thing. We can do that given the platforms we have. But right now, from the reports we have, literally as of today, it appears that the vaccines will still be effective against them. With the caveat in mind, you want to pay close attention to it. So, Jim, why don't I just stop there and then maybe just answer some questions on anything else that I said. So, yeah.
How helpful would it have been if Amazon got involved with the federal response to COVID-19 before Biden took office? And do you know about any plans or discussions ahead of yesterday?
No, I don't think I could answer that question. I'd be waving my hands about that, sorry. Well, one of the new things in this administration is if you don't know the answer, don't guess. Just say you don't know the answer. Yeah, yes.
Dr. Fauci, a couple of questions, if I might. I'd like to follow up with you on what you just said about this strain in South Africa. Has that strain made its way to the United States? And what, if any, concerns do you have? How much do we understand of that?
Great question. Thus far, it does not appear at all that the South African strain is in the United States. However, we must be honest and say that the level of comprehensive sequence surveillance thus far is not at the level that we would have liked. So we're going to be looking very, very carefully for it. But given the information we have today, it doesn't appear that the South African strain is here.
Just ask you about the effort to distribute the vaccines, because of course, that's what makes people want to know, when are they going to get a vaccine? Is the Biden administration starting from scratch with the vaccine distribution, or are you picking up where the Trump administration left off?
We certainly are not starting from scratch, because there is activity going on in the distribution. But if you look at the plan that the president has put forth about the things that he's going to do, namely get community vaccine centers up, get pharmacies more involved, where appropriate, get the Defense Production Act involved, not only perhaps with getting more vaccine, but even the things you need to get a good vaccine program. For example, needles and syringes that might be more useful in that. So it's taking what's going on, but amplifying it in a big way.
President Biden said that what was left was abysmal, essentially. I mean, is there anything actionable that you are taking from the previous administration?
Over 70 years ago, from in
Is that delaying your efforts to get the vaccine? I mean, that's the question.
No, I mean, we're coming in with fresh ideas, but also some ideas that were not bad ideas with the previous administration. You can't say it was absolutely not usable at all. So we are continuing, but you're going to see a real ramping up.
Final question, you had said that most people will be vaccinated by the middle of 2021. Is that still your expectation?
Yes, it is. I mean, I believe that the goal that was set by the president of getting 100 million people vaccinated in the first 100 days is quite a reasonable goal. And when you get to the point, and one of the things that I think is something we need to pay attention to, and I, quite frankly, have been spending a considerable amount of my own time, is outreaching, particularly to minority communities, to make sure that you get them to be vaccinated and you explain why it's so important for themselves, their family, and their community. If we get 70 to 85% of the country vaccinated, let's say by the end of the summer, middle of the summer, I believe by the time we get to the fall, we will be approaching a degree of normality. It's not going to be perfectly normal, but one that I think will take a lot of pressure off the American public.
You're one of the few holdovers from the previous administration, this current one. What has been your experience with this new team? And in your view, what would have been different in terms of the trajectory of this outbreak from the start had a team like this been in place at the beginning?
Well, I can tell you my impression of what's going on right now. The team, I don't know if I can extrapolate other things, but one of the things that was very clear as recently as about 15 minutes ago when I was with the president is that one of the things that we're going to do is to be completely transparent, open, and honest. If things go wrong, not point fingers, but to correct them, and to make everything we do be based on science and evidence. I mean, that was literally a conversation I had 15 minutes ago with the president, and he has said that multiple times.
That you, looking back on your comments over the last kind of 12 months, would like to now, with that sort of license, to amend or clarify?
No, I mean, I always said everything on the page. That's why I got in trouble sometimes. Right? Yes.
You mentioned pharmacies. The new CDC director said today that the goal of getting vaccinations into pharmacies by the end of next month isn't realistic, as had been previously suggested. When will most Americans be able to get a vaccination in their neighborhood pharmacy?
Well, I didn't hear that comment that you're talking about, Dr. Walensky's comment. I didn't hear that comment, so I don't really want to comment but what she may be saying is that for many people in this country who don't have access to a pharmacy, they may not be able to utilize getting things in the pharmacy. I'm not sure. I want to be careful because I'm not sure that's what she said. We just had a conversation about how we're going to get vaccines to people who are in pharmacy desert areas where they don't have easy access to a pharmacy. And that's something we're working on and taking very seriously.
To be clear, if you are in an area where you do have access to a CVS or a Walgreens, when will you be able to get access to this vaccine like you would a flu vaccine?
You know, in the spirit of not guessing, I really am not quite sure when that will be, but we can get back to you on that.
Just on the broader timeline, you mentioned the fall. We just heard the president say, you know, the brutal truth is that it is going to be several more months. Just to be clear, you're saying by the fall, the majority of Americans you think will be vaccinated?
No, I didn't say that. I said if we get the majority of Americans, 70 to 85% vaccinated by then, we could have a degree of herd immunity that would get us back to normal. The concern I have, and something we're working on, is getting people who have vaccine hesitancy who don't want to get vaccinated. Because many people are skeptical about that. So we really need to do a lot of good outreach for that. You know, I don't know what the best case scenario for me is that we'd get 85% of the people vaccinated by the end of the summer. If we do, then by the time we get to the fall, I think we can approach a degree of normality.
On the mutations that you were talking about, a question about how exactly they increase transmissibility. Does it take less exposure time to get?
No, what it is that you can do in vitro in a test tube setting, binding an affinity to the receptors, which you have in your nose, in your lung, in your GI tract. The receptor for the virus is called an ACE2 receptor, and the facility or affinity with which a virus binds to that means that it very likely will have a better efficiency of infection and replicate more in the nasopharynx. So that's how you make that determination in the test tube. Then you look epidemiologically and you see a spike going up in the sense of number of cases, and they sort of match each other. A virus that has the ability to easily bind to and replicate with your receptors is one that likely will spread easier.
That you'd have more viral load.
Oh, you could, yes. In fact, it would mean, because if it binds more easily, it could replicate in the nasopharynx more easily, and it is likely that you would have a higher viral load.
Make masks less effective in that case?
No, it makes it the reason why you absolutely should be wearing a mask. It doesn't necessarily make it less effective. If you properly wear a mask, then you'll be okay.
UK strain, do you have any data on how widespread that strain is in the United States?
Well, I think it's in at least 20 states that people have mentioned exactly. The real question that's going to be asked, is it going to become the dominant strain, or will the strains we already have prevent it from flourishing and being the more dominant strain? But it is here, for sure. Yeah.
Just a follow-up on vaccines. Some state and local authorities are saying that they would be able to distribute more vaccines if they had more. Is the Biden administration now trying to increase production by Moderna and Pfizer in the next 6 weeks?
Yeah, as well as to utilize what we hope will be another player in the field, the J&J, Janssen, as well as other of the companies. But also, as the president has said in his plan, to do whatever he can to expand the availability of vaccines, whatever that is. I mean, he said that he's going to just use every possibility, including the Defense Production Act.
Can you explain the discrepancy between what some states are saying about needing more vaccines and the CDC saying that a lot of vaccine is still remaining on on their shelves?
Yeah, you know, I think that is something that we need to really take a close look at, because that is sort of an inconsistent discrepancy. And one of the things we want to do is to find out why that's the case. And if it is the case, particularly the thing that would be most disturbing, if there's vaccine laying around and people are not using it when others would need it. But I don't know the answer to that question, but we need to look into it.
Dr. Fauci, you've joked a couple times today already about the difference that you feel in being kind of the spokesperson for this issue in this administration versus the previous one. Can you talk a little bit about how much different do you feel, less constrained? What is the, I mean, you for so many times you stood up behind a podium with Donald Trump standing behind you. That was a different feeling. I'm sure than it is today. Can you talk a little bit about how you feel kind of released from what you have been doing for the last year?
Yeah, but you said I was joking about it. I was very serious about it. I wasn't joking. No, actually, I mean, obviously, I don't want to be going back, over history, but it was very clear that there were things that were said, be it regarding things like hydroxychloroquine and other things like that, that really was uncomfortable because they were not based on scientific fact. I can tell you, I take no pleasure at all in being in a situation of contradicting the president. So it was really something that you didn't feel that you could actually say something and there wouldn't be any repercussions about it. The idea that you can get up here and talk about what you know, what the evidence, what the science is, and no, that's it. Let the science speak. It is somewhat of a liberating feeling.
Basically vanished for a few months there for a while. You feel like you're back now?
I think so. Okay.
That's Mike Shear. You don't want to take questions from him. Thank you, Dr. Fauci, so much for joining us. We really appreciate it, and we'll have him back again. So, well, thank you, everyone. As I promised, we'll have a full briefing from here. So, as you know, just a few moments ago, the president also released a national COVID-19 strategy and signed 10 executive orders and other directives to move quickly to contain the crisis. Underpinning everything the president signed today and everything we do every day will be equity. Some highlights of those actions include an executive order to fill supply shortfalls for vaccinations, testing, and PPE. The president directed agencies to exercise all appropriate authorities, including the Defense Production Act, to accelerate manufacturing and delivering of supplies such as N95, masks, gowns, gloves, PCR swabs, test-free agents, and necessary equipment and material for the vaccine. The president also signed a presidential memorandum to increase federal reimbursement to states and tribes for the cost of National Guard personnel, emergency supplies, and the personnel and equipment needed to create vaccination centers. An executive order that established a COVID-19 pandemic testing board to bring the full force of the federal government's expertise to expanding testing supply and increasing access to testing. An executive order to bolster access to COVID-19 treatments and clinical care, establishing a comprehensive and coordinated preclinical drug discovery and development program to allow therapeutics to be evaluated and developed in response to pandemic threats. Sorry, I had to clear my throat. There's a lot here. He also issued an executive order directing the Departments of Education and Health and Human Services to provide guidance on safe reopening and operating for schools, childcare providers, and institutions of higher education. An executive order on the Occupational Safety and Health Administration to immediately release clear guidance for employers to help keep workers safe from COVID-19 exposure. An executive order to require mask wearing in airports or certain modes of public transportation, including many trains, airplanes, maritime vessels, and intercity buses. And an executive order establishing a COVID-19 health equity task force, something we had previously announced, but making it official today, to provide specific recommendations to the president for allocating resources and funding in communities with inequities in COVID-19 outcomes by race, ethnicity, geography, disability, and other considerations. These steps, of course, build on the actions we announced yesterday. I had an additional update. Some of you may have seen this come out through late last night, but I wanted to share with you that as a result of one of the executive orders President Biden signed yesterday, the acting Homeland Security Secretary issued a memorandum to review and reset immigration enforcement priorities. For 100 days, beginning tomorrow, the Department of Homeland Security will pause removals for certain individuals. This pause will allow the administration to review and reset enforcement policies and ensure that resources are dedicated to the most pressing challenges and that we have a fair and effective enforcement system rooted in responsibly managing the border and protecting our national security and public safety. I had one other item I just wanted to flag for you about something the First Lady is up to. Let me see if I can find that, or I will circle back to it a little bit later. With that, I'm happy to take your questions. Zeke, why don't you kick us off?
Thanks, Jen. You did hear some reporting earlier today about the president's commitment to extending New START. Can you talk about what the president's directive on that front has been? Additionally, did he confirm that the president requested reports from the new DNI for an assessment of potential foreign interference in the 2020 elections and also the SolarWinds Act?
I can confirm that the United States intends to seek a 5-year extension of New START as the treaty permits. The president has long been clear that the New START treaty is in the national security interests of the United States, and this extension makes even more sense when the relationship with Russia is adversarial, as it is at this time. New START is the only remaining treaty constraining Russian nuclear forces and is an anchor of strategic stability between our two countries. And to the other part of your question, even as we work with Russia to advance U.S. interests, so too we work to hold Russia to account for its reckless and adversarial actions. And to this end, the president is also issuing a tasking to the intelligence community for its full assessment of the SolarWinds cyber breach, Russian interference in the 2020 election, its use of chemical weapons against opposition leader Alexei Navalny, and the alleged bounties on U.S. soldiers in Afghanistan. So that's hopefully answered all of it. That was a mouthful.
And just to change gears for a quick second to
We are listening in on a news conference. It's Jen Psaki, the new press secretary for the Biden administration. She will become quite familiar in the days ahead to news viewers as this administration resumes the idea of daily press briefings. Fair amount of news, though, made at the beginning of this by Dr. Anthony Fauci talking about these variants we've been watching very closely, the UK one, and the one that he seems to think is more troublesome, a South African variant that they don't believe is in the U.S. right now, but could somewhat diminish the effectiveness of the vaccine. Before I get a little too far over my skis, let me bring in Dr. John Torres, NBC News medical correspondent. Dr. John, did I frame that correctly?
You did frame it correctly, Lester. What he was basically saying is we're looking at the UK variant, we're looking at the South African variant, which is fairly close to the Brazil variant. And he's saying with the UK variant, we know that it can cause people to be more contagious. They can catch and spread the disease easier, but it doesn't appear to be more, the word he used was virulent, meaning it doesn't appear to be more deadly, but it is a numbers game. So the more people that get it, the more people are going to have effects and even die from it. And so he warned about that, but then he switched to the South African variant. And he said there, it's a little more worrisome because we're actually looking at that and finding that with monoclonal antibodies, which is one of the treatments we have, they don't seem to be as effective with this variant out of South Africa. But they haven't detected that variant here in the U.S. yet. And then he went on to talk about vaccines. He said that the vaccine, and the bottom line he used is, as of today, it appears the vaccine is effective against it. And he said that's mainly because of what they call the cushion effect. In other words, the vaccine works so well that 95% effectiveness, they can get that down a little bit, and the vaccine will still work fairly well. So he's saying, even though it doesn't work as well against the South African variant, it's still going to work against the South African variant. We just don't know to what degree, but we think to degree enough that we can get things under control. But Lester, I do have to tell you, one of the most enlightening things I think we heard is the fact that he was talking more freely. He mentioned what happened back with the prior administration, particularly with hydroxychloroquine, and how that wasn't based on science, and he wasn't able to say anything. And now he feels like he can say these things that we think are important, at least in the medical community, Lester.
Yeah, he certainly seemed to have a degree of greater freedom in his comments. Doctor, thank you. Let me bring in Tom Costello, who's been covering the vaccine rollout for us. Tom, Dr. Fauci mentioned this Johnson & Johnson vaccine that appears to be rather close. What can you tell us about that?
Yeah, that's right. We expect an announcement could come as soon as the next week or two, suggesting that the Johnson & Johnson data on their stage 3 clinical trials is positive, and in fact, that they be ready to go ahead with a request for emergency FDA authorization, emergency use authorization. So that could happen within just a matter of weeks now. And the nice thing about the Johnson & Johnson vaccine, if and when it becomes available, is that it's a single shot. You know, the Pfizer vaccine and the Moderna vaccine, which are now out there, require the initial vaccine and then the booster shot. Johnson & Johnson would only require the single shot. And I'll tell you another
had a
item that's being
bunch to
discussed right now
practice
in medical
grouping
circles
words together and
across the
seeing how
country and
words
among top
connect to
researchers.
each other.
You know,
In
if we're
order to
having
use this
trouble
strategy
getting
effectively,
these doses
it's
into
necessary to
arms,
first
and
select
we
a
are, there's
concept
a
to
significant
explore.
bottleneck.
It can be from
Can you
something that has been
forego
read
the
or
booster
from a
shot? Can
unit
you
of
just go
study.
with
So
the
last
initial vaccine for
Monday,
now
we read a
and
story
wait
called
weeks or
The
months
Gardener,
before the
and
booster
it
shot
was
would be
full
given?
of
And there is
garden
some new
words.
thinking
So I'm
that
gonna
that
think
may be
about
possible.
gardening
That
words
maybe
for
you
a
don't
minute.
need to give that booster
When
shot
I
within
think
2
of
to 3
gardening,
weeks.
I
Maybe you can
think
wait weeks
The
or
first
months to
step
give the
is to
booster shot,
brainstorm a
and
list of
therefore
words
you'd free up
related to
more
the
vaccine
topic.
and you'd be able to
of
get more people vaccinated. There's nothing definitive on
I
that yet
think
because, as you know, this
lettuce.
entire episode with the
I want you to
coronavirus
think
and the
about
vaccines,
gardening
we're kind
words,
of living
and
this
I want you
test
to
as
raise
we
your
go
hand
along, right?
and
We're
help
learning
me
as we go.
brainstorm some
But that
other
is
words
one
that come
area
to
that
your
they're now
mind when you
considering.
think about gardening.
Maybe they can wait on the booster shot for the
Bella?
Moderna and the Pfizer vaccine. That's one area of research they're working on.
Savia? Minerals.
All right,
Mineral?
Tom, thanks
Once
very
there
much.
is
I
a
want to bring
nice
in White
long
House
list of
correspondent
words,
Jeff
it's time
Bennett.
for step two.
Jeff, to say that this
Now it's
administration
time
is
to
getting
group
off to a
these
very
words.
busy start
I'm
is
gonna think
probably
about
an
these
understatement.
words and think about how I might put them.
I think that's a fair
Together, if I
assessment,
wanted to
Lester. And look,
cluster
President
them.
Biden today
So the first
fulfilling
one
a
I'm gonna
key
put on
campaign
this list
commitment on his
is
first
soil.
full day in
I'm gonna
office,
put it here.
unveiling a
Soil.
battle plan to combat the coronavirus and
Let me
signing
think of some other
10
words that
executive
go with
actions
the
to
word
boost
soil.
vaccination accessibility, to boost
I'm gonna
testing,
put
to bring
sunshine.
about a
I'm
national
thinking
school
about things
reopening
that
plan
plants
that will safely
need,
reopen
soil
schools.
and
We heard
sunshine. Let me look at the list
Dr.
and see what
Fauci in
else
that briefing
plants
today.
need.
He said
Water.
that he views it
I'm
as
gonna put
entirely
water over there,
reasonable,
too.
President Biden's plan
There's
to have
no right or
100
wrong
million shots
answer.
in arms,
I'm
as he
just
so
kind
often
of
says,
thinking about it. As
within
long
the
as
first
I can
100
explain
days
why
of
I
his
put those
presidency.
words
That
together,
is a goal
then
that
they go
has been
together. Who can
complicated
think
by
of
the
another word that they
situation
might
that
want to
President
group
Biden
together?
says he inherited from the last
Virginia?
administration. He said that the vaccination plan that President Trump left for him is a dismal failure, to use the phrase. And so now President Biden is hoping to use the
The
Defense
third and
Production
final
Act,
step
which
is
is a
labeling the
1950s
groupings
era
with
law that
headers.
effectively
These
compels
titles
private
should be
companies
related
to
to the
produce whatever
reasoning
items are
behind
needed
each
for the
cluster of
public
words.
good.
I'm
So in
gonna
this
write a
case,
little
that would be more
header
raw
here
materials
that
to
says,
make more
what
vaccines,
should
to
I
make
say?
more
Just said it pretty
PPE so that the people
perfectly.
administering the
What should
vaccine
I
can do
write?
it safely, to make more
Things that
syringes,
come out of
anything that would be
Now
needed
that
to
the
get those
entire
vaccines
strategy has been
off a
modeled,
factory
it's time
floor
to let
into
the
a
kids
truck
take
and
the
from that
wheel.
truck
Hello,
safely
decided
into
to have the whole
someone's
class work on
arm. So
brainstorming
it's a
together
Herculean
before the
task
students
right
move
now,
into their
sitting
small
before
groups.
Okay,
Joe
now I
Biden
want
and
you
also
to get
Dr.
a
Fauci.
chance
Let's not
to
forget, I think
think up
what
some
was
words,
particularly
move the words
noteworthy
around,
about
and
everything that
connect
he
words.
said is that
And
Dr.
this is going
Fauci,
to
who
be
is now
fun.
Joe
So
Biden's
I'm
chief
gonna write your
medical
text here,
advisor,
and now
is the
you
only
need to do
Biden
some
official who has the
brainstorming.
perspective of having
Raise your
worked
hand and let
in
me
the
know
Trump
of
task
any
force as
word you
well,
can
the
think
Trump
of that
COVID
relates
task
to
force.
insects.
And so now he brings all of that
Margot?
experience and all of the issues
I'm
that
going
they
to add the
really
word
came up
stink.
against and had to deal with
What are
now
you going
into the
to
Biden
add?
White House.
add butterfly because.
All right, Jeff Bennett, thanks very much. And we should note the president did speak a little earlier today as he signed some of these executive orders, and he did remind us that
I'm gonna
he
put
believes
legs
things will get
and
worse before they
butterfly.
get better. He noted that the number of deaths could likely top 500,000.
I want you to
by
stop
next
for a minute. I know you're so
Brimstone.
excited.
I'm
But
Lester
you're going to
Holt in
get a
New York. I'll
chance
see you
now
this evening with
to
a
group
complete
these
wrap-up
words
of
together.
President
And if you
Biden's
have
first full
more
day in
insect
office
words,
coming
you
up
can
on
throw
NBC
them
Nightly
in
News.
your
For now,
groups. You
good
can
day,
write them
everyone.
right down in your groups. So now here's the fun part. You are going to get a piece of paper that looks like this, a big chart paper, and you will get a chance to try grouping
Members
these
of
words
both parties,
together. Just
picking
remember
up
that
the
as
phone
long as
and
you
having
can
those
explain
conversations.
to your partner,
He saw, of course, members of
This is
both
a
parties. He invited leaders from
then
both
it
parties
fits
to
there.
join him at
There's no
church.
right or
Obviously,
wrong
that wasn't
answer
really
for this.
a discussion
It's an
about
opportunity
specifics
to
of the
connect
bill,
words to
but
each other
he
and
did have an
have your
opportunity to talk about
vocabulary grow.
his agenda and
As
working
words in small groups,
working
it's
together on
important
his agenda moving forward. But I think you will see him quite involved in the days ahead, but you will also see the vice president quite involved. You will also see policy leaders like Brian Deese and others in the administration quite involved and having conversations with both Democrats and Republicans.
Right now to sit down with them?
Well, I think we will have more to share with you soon in terms of engagement of many of our senior officials with members of both parties.
And on the Defense Production Act, just to be clear, has the administration actually invoked the Defense Production Act? And if so, can you spell out what changes we may see because of this? Which companies are being asked to make what?
Well, let me give you a very specific example that helps really make it clear for me. One area is to acquire more low dead volume syringes, and what that does is these specialized syringes allow pharmacists and vaccinators to extract an extra so making more doses available, of course. It also prioritizes the Defense Production Act raw materials that are used to produce the vaccine, so we're reducing the bottlenecks. And it enables manufacturers, us to empower and involve, I guess, in action from manufacturers to make sure we have the materials we need to get the vaccines out the door and in the arms of Americans. In terms of, obviously, we signed it this afternoon. I'll have to just circle back with you on what it means, if it's officially invoked in this moment or if it takes some time, and we can circle back with you after the briefing. Go ahead, Jen.
On stimulus, is the White House drafting a legislative bill?
You mean in terms of the what he announced last Thursday? Well, he announced what his specific ideas will be and what his vision is. But right now we're having discussions with members of both parties, as we have for the last week, about what that will look like.
Okay, so no bill draft coming out of the White House as well?
Well, I'm happy to talk to our legislative team about that. I think what was important to the president was to outline what his vision would be. This is how the process should actually work, right? The president outlines, here's my vision, here's what I think should be in a package. Let's have discussions, let's have engagements with both parties, and let's see what comes out of the sausage making at the other side. Go ahead, Anita. I'll come back to him, sorry, I couldn't see you. Go ahead.
Just following up on what Kristen asked, I don't think I heard an answer about whether the president supports keeping the filibuster, or where he sits on that. Has he talked to Senator Schumer about that? I mean, he served there a long time. What are his thoughts on that?
I think what I was conveying to Kristen is that the president has been clear. He wants to work with members of both parties and find bipartisan paths forward. And I don't have any more conversations to read out for you.
Specifically answer that, unless I'm not understanding your answer.
I don't think I have more to add to my answer.
And then just on the impeachment trial, I know that there was some talk about sort of the Senate doing both things at the same time, two things at once. There's some reporting this afternoon that Republicans are pushing to have the impeachment trial start in February. Where do you all stand still now on that? Are you still looking for that both paths to happen at the same time? Would it be preferable to do that first, or are you okay with later as some Republicans are talking about?
Well, I mean, I think we have been pretty consistent that we believe the timing and the mechanisms for the Congress and the Senate moving forward in holding the former president accountable, we'll leave that to them. And what our biggest priority and focus is ensuring that it doesn't delay the Senate, Congress moving forward in consideration and discussion around the COVID relief package that the president proposed last week.
Go ahead. The Supreme Court, I have a question for myself and then a question for someone who cannot be here because of the social distancing choices. My question is this, and it's about unity again. I've heard from conservatives who are afraid that the president is going to try to pull back religious conscience exemptions for groups like Little Sisters of the Poor. The president pledged he would do that in July when Little Sisters won a case in the Supreme Court. The Health and Human Services nominee Javier Becerra pursued that line of going after the exemptions as Attorney General of California. What's the president going to do on that?
I haven't discussed that particular issue with him. I'm happy to circle back with you, but I don't, there's not a change in his position from what he said earlier this summer. Did you have another question?
Question from Adam Longa of WUSA 9. He says, we saw the president warmly greet Bowser during the parade yesterday. She's pushing for the DC statehood measure to be on the president's desk within 100 days. Will the administration get behind this bill, and does the president support it?
I hate to disappoint you,
Hello
but I will have to
for
circle back
viewers.
with you on that as well. There's quite a bit going on. I have not discussed DC statehood with him in the last 36 hours.
We're to hear you.
Okay, sounds great. Go ahead and back.
Yeah, thanks, Jen. I wanted to circle back on something COVID related. I know the president has obviously made a priority of resuming in-person learning in the first 100 days. I wonder, is the administration planning to issue any kind of uniform guidance to states on, whether it's reopening schools, reopening businesses, indoor dining, stuff like that? Or are you all planning to just kind of leave it to states to do sort of a patchwork based on their own situations?
Well, as Dr. Fauci conveyed, our objective is to ensure that health and medical experts are leading the effort in delivering guidance, determining guidance, and also communicating it with the public whenever possible. And any guidance would come, of
Your
course, as you
partner
know, from the
might say,
CDC.
hey, wait a minute.
We
I
will,
think
we will, of
massive
course,
is
defer to
bigger
that.
than
But
gigantic.
part of our priority
I'm
and
not
our
sure
focus
what
here
bulky
is
is.
on
Let's talk about
providing
bulky
more
before we put it in any
engagement
order
with
on the
states,
line. Does that make
more
sense
clear
to you?
guidance
Okay.
from the
Lawyer,
federal
once
level
the instructions
in terms of
and supplies
how
have
we're
been
planning to
handed out,
operate,
allow
what
the
data
students
we're
to work
seeing,
independently,
how
either in
how
small
vaccines
groups
are being
or
distributed, what we see as the challenges, and that communication has been lacking, as we understand it from our conversations in the past few months. So that is what we will focus on improving in the months ahead.
Would you specifically, are you planning to do, you know, daily or weekly calls with states, or how are you planning to up the communication?
Well, we have an entire COVID team, as you know, who are now, most of them are official, and part of their role will be engaging with governors, Democrats and Republicans, mayors, local elected officials, to gain a better understanding of what's happening on the ground. That will be how they're going to be intaking a great deal of information. Obviously, health care providers and experts on the ground as well. We will also do engagement from the level of the president and the vice president as well, because they also want to have that conversation with states and local officials on what they're experiencing, what they see the challenges as, and how they can be addressed. And you know, that's something I think in President Biden's heart. He is a local elected official still, and he gets into the weeds of what they're experiencing, and he will be involved in that himself. Go ahead and say that.
Thanks, Jen. There's a lot of really big things that the administration wants to do: infrastructure, the stimulus, tax reform. Can you sort of lay out the cadence for us over the upcoming year? How do you envision those three major things playing out? What's the order? When do you think those will be taken up? When will they happen?
Well, what I can lay out for you on our first full day here is what our initial priorities are, and they revolve around addressing the 4 crises that the president has stated that the country is facing, including getting the pandemic under control, getting people back to work, addressing our climate crisis, and addressing racial equity. And so, go ahead.
No, I was going to ask you, do you think tax reform happens in 2021?
I don't really have any predictions for you on that. I think at this point in time and for the foreseeable future, addressing the pandemic, getting the pandemic under control, and that linkage to getting people back to work will be his top priority.
Keystone XL, the decision yesterday from the president. What would you say to those who have lost their job or will lost their job as a result of that decision? What would the message from the president and the White House be?
The message of the president and the White House would be that he is committed. His record will shows the American people that he's committed to clean energy jobs, to jobs that are not only good, high-paying jobs, union jobs, but ones that are also good for our environment. He thinks it's possible to do both. He led an effort when he was the vice president to put millions of people to work with both of those priorities in mind, and he will continue to do that as president. But he had opposed the Keystone Pipeline back in 2013 when it was when there was a consideration of the permit. Sorry, I don't think it was 2013. I think it was a little bit after that. And he's been consistent in his view, and he was delivering on a promise he made to the American public during the campaign. Go ahead all the way in the back.
Thank you. I wanted to ask you about India-US relationship. What is President Biden's vision of an India-US relationship, the relationship between the world's oldest and world's largest democracies?
Well, first I would say that President Biden, who of course has visited India many times, respects and values the long bipartisan successful relationship between leaders in India and the United States. He looks forward to a continuation of that. Obviously, he selected and yesterday she was sworn in, the first Indian American to serve as president or vice president. It's certainly a historic moment for all of us in this country, but a further, cementing of the importance of our relationship. So, go ahead, George.
Yeah, thanks. 2 questions if I could. One on the Hatch Act. Will this administration take that seriously, and do you think it's ever appropriate for this White House to have a political event or a political meeting?
Well, as you know, there are some political events that are acceptable, but we certainly take the Hatch Act seriously and will abide by that. And you will not see a political rally on the south lawn of the White House with under President Biden.
second one, this may sound trivial, but
Roger. I'm going with you. They'll arrest me. Kill you.
Alright guys, bye.